Good morning, and thank you so much for participating in today's webinar. This webinar is the second in the 2016 Winter Webinar Series, 21st Century Student-Centered School Nursing. Today the topic is School Nurses, Building a Culture of Health. NASA's Executive Director, Donna Mazik, will moderate today's webinar and will introduce the panelists. Welcome, Donna.
Thank you, Margaret. Hello, everyone. I'm Donna Mazik, and I'm happy to present to you this second in a series of winter webinars for this year. I'd like to now introduce you to Dr. Susan Hassmiller. Susan is a senior advisor for nursing at the Robert Wood Johnson Foundation. She's also a member of the Institute of Medicine. Susan, thank you for being with us today.
Thank you so much, Donna. I am incredibly glad to be with you today, and I want to thank you and Beth, Maddie, of course, for inviting me to talk to you today about the school nurse role in building a culture of health. School nurses, and I realize I'm speaking to the choir here, but this is my opinion and the opinion of many. School nurses are certainly deeply embedded in the fabric of the community, and you have a vital role to play in forming partnerships both inside and outside the school setting to build a culture of health, and that means to enable everyone to live the healthiest life possible. Now I have a short video, and I hope it will be fine, but it'll set the context for the rest of the presentation.
On healthcare. In 2013, we spent nearly $3 trillion, which was It should come as no surprise that the U.S. spends a lot on healthcare. In 2013, we spent nearly $3 trillion, which was equivalent to 18% of our GDP. In fact, we spend more on healthcare per person than any other country in the world. Despite these costs, the U.S. is actually falling behind many other countries on a number of important health indicators, including the most important health indicator of all, life expectancy. 30 years ago, our average life expectancy ranked 15th in the world. Today, it ranks 43rd. So what's the problem? As it turns out, only a fraction of what affects our life expectancy is actually related to healthcare. Studies have shown that your zip code is more important than your genetic code when it comes to determining your health. To truly improve outcomes, we need to look beyond healthcare at a variety of factors that impact health. Things like access to housing, schools, jobs, the ability to exercise. Now, traditionally, the health and community development sectors have worked independently, but they don't have to, and in fact, they really shouldn't. Well, take a look at this. Here's a map of Los Angeles County that highlights economic hardship. Here's a map that highlights childhood obesity. Now, as you can see, they're basically the same map. Oftentimes, the health and community development sectors are working in the same areas and don't even know about it. The good news is we're getting better at collaborating. More and more, we're starting to realize that the most impactful projects draw upon the expertise in many different fields. One example is the recent construction of Breathe Easy Homeless by the Seattle Housing Authority, designed to reduce the effects of asthma. Now, asthma impacts millions of people in the U.S. each year. It costs the U.S. healthcare system billions of dollars. Recognizing the link between housing, environment, and health, the Seattle Housing Authority partnered with local government and academic professionals to raise funds for the construction of special affordable housing units designed to improve the internal air quality for residents. The slight improvements made to the design, materials, and construction of these homes led to residents having 63% more symptom-free days, fewer visits to the doctor's office, and less healthcare costs. Health-related investments are also becoming an attractive prospect for banks. Recently, Morgan Stanley, the Cresby Foundation, and LISC launched a $100 million investment fund designed to improve access to healthcare, housing, and provide services that connect the two in low-income communities. The fund will build 500 housing units with health services, construct 8 federally qualified health centers that are estimated to service 75,000 people, and create 1,400 jobs in struggling communities. These examples are representative of a larger and exciting trend. As we establish new partnerships, we'll create new opportunities, but we need more people to join the conversation. We need to leverage the expertise of leaders in finance, health systems, community development, and policy to create a marketplace that truly values health. And in this marketplace, everyone wins. To learn more about this initiative and how you can get involved, check out the resource section below.
Okay, so we'll go to the next slide. Am I there? Hello? Yes. Somebody muted me. There you go. Okay, we'll go to the next slide. Can you hear me?
Yes.
I think somebody needs to turn the slides on.
We just need to do a screen share.
Yep. Donna needs to show the screen. I think there we go. Okay. Thank you so much. So as you can see, the impact of poor health at your schools, there's really quite a connection. The percentage of children and adolescents in the U.S. with chronic health conditions has increased from under 2% in the 1960s to over 25% in 2007, and I'm sure it's higher than that now. Childhood obesity, asthma, and diabetes are on the rise, and poverty, lack of parental involvement, and lack of access to high-quality health care can exacerbate all of these problems. Next slide. And what the video really tried to show is what I am showing on this slide in particular as well, which is that the determinants, we call them the social determinants, such as education, employment, income, family and social support, community safety, things that are listed as social and economic factors, really has the most to do with a person's health and well-being. You can see that 40% of a person's health and well-being are affected by those factors alone. Next slide. So the choices that we make are based on the choices that we have. It's quite a simple statement, but very telling. If we only have so much to work with, the community that we're from, the family in which we are embedded, those are the choices that we have. Next slide. So the Robert Wood Johnson Foundation, where I am the Senior Advisor for Nursing, has created a new vision to take on one of the most pervasive challenges of our time, improving the health and well-being of everyone in America. That is very lofty. We really do understand that. But a culture of health places well-being at the center of every aspect of life so that all communities can flourish and all individuals thrive, regardless of race, creed, income, or location. And it's built on the premise that everyone deserves to live the healthiest life possible. Next slide. The nursing workforce stands ready to build a culture of health. I really believe so strongly in our role in this entire mission. For the past 5 years, the nursing community has joined with other partners to advance the Institute of Medicine's recommendations on the future of nursing. Many of you will recall that this landmark report was published at the end of 2010. I was the study director for this book, being placed at the Institute of Medicine for 2 years. The chair of that committee was Dr. Donna Shalala, the longest-serving Secretary for Health and Human Services our country has ever had. And we really started with not what's best for nursing, if you will, but how are we going to, where the country is in terms of health and health care, and then what can nurses do most effectively to address the greatest challenges in our health and healthcare system. And out of this report came 43 recommendations that we, at the Campaign for Action, the Future Nursing Campaign for Action, have been working on. The focus of the campaign has been on strengthening nursing education, advancing practice, promoting leadership, fostering interprofessional collaboration, and improving workforce diversity. And we've made great progress in increasing the number of diverse nurses with education and leadership skills. And you can see the campaign vision in the slide here. From the beginning, our mission, our vision for this campaign has always been that everyone in America can live a healthier life supported by a system in which nurses are essential partners in providing care and promoting health. And RWJF and AARP, the nation's largest consumer organization, has led this campaign. We have 50 action coalitions plus the District of Columbia, all working to affect change at the national and state levels. And maybe some of you are involved in your state action coalitions. I hope so. And after this presentation, I hope you will be. Nurses need to have the education and leadership skills required to build a culture of health. So the action coalitions will continue to advance the IOM recommendations on the future of nursing. But the main purpose of nursing is really to advance health in our country. And nurses are already where people live, learn, work, and worship and play. So the next step of our campaign will be to merge the future of the nursing recommendations with building a culture of health. Next slide. And while we are building, and while we're building a culture of health, it may seem like a new plan to us at the campaign. It fits in so well with advancing the IOM recommendations. Our intended strategy 5 years ago, as I showed, was to advance the IOM recommendations on the future of nursing to improve health through nursing. But now, with our new mission, now building a culture of health is an emergent strategy being adopted by Robert Wood Johnson Foundation. And this provides us with an opportunity, a wonderful opportunity to envision and achieve our work differently in a much, much bigger way. It's really synergistic to help everyone live the healthiest life possible. And the difference is that we'll need to work now with multiple organizations to achieve our goals. And that's why school nurses are so critical to our strategy. Next slide. You are integrated in your schools and communities. You've got your fingers on the pulse of what's going on, and you keep students healthy in communities in which students live, learn, and play. You also certainly address family issues as well. You have to. Your clinical background and experience in promoting health make you ideal for speaking the language of both public health and health care. You stand poised to bridge the cultural divide between health and health care. So I hope you'll join the Robert Wood Johnson Foundation and our many partners in building a culture of health community by community. Next slide. And Robert Wood Johnson Foundation would love to have more school nurses apply, not only to be part of our action coalitions, which is what I'm really hoping for, but we have a number of grant programs at the foundation, and listed on this slide are some of the new leadership development programs that we will announce to the world on February 22nd. And if you go to rwjf.org, you can read about the leadership programs, but you can also read about many of the other grants programs that we have, again, centered around building a culture of health, which you are so vitally involved with at this time. So now, last slide, this is our website. And you can go to this particular website by going to campaignforaction.org. I'll just show you that at the top bar you will see state action coalitions, and you can actually click onto that state action coalition, click onto your state, whether it's New Jersey, Minnesota, California, Texas, and you can see who your leaders are in the state and what's going on. Many of the state action coalitions have their own website, and you can see about joining. With that, Donna, I am going to turn it back over to you, and I'm so anxious to hear from the school nurse panel that you've put together. Thank you so much for inviting me today.
Thank you so much, Susan. We appreciate all that you've shared with us, and we are truly looking at school nurses building a culture of health. Right now, I'd like to introduce NASN's president, Beth Maddie. Beth?
Thank you, Donna, and thank you, Dr. Hassmiller. I certainly appreciate you sharing the vision of healthcare as promoting health in the community and your support of school nurses and the care they provide to children. I've always said school nurses create a culture of health in the school community. And now as nurses are encouraged to lead this transformation of health, providing care and promoting health, and bringing health and wellness care to where people live, work, learn, and play. School nurses say, welcome to our milieu. You said it nicely when you said school nurses know the language of public health and health. We also bridge education and health. This is the practice of school nursing. I'm delighted to introduce Robin, Brandy, and Bobby today, who will share what they, along with their teams, are leading in health and wellness. These three nurses have a very different practice arena and varying experience, but they actively demonstrate what school nurses are doing across the country. First, I'm going to introduce Robin Landis-Wallen. She is the new Director of Health Services at Parkway Schools in St. Louis, Missouri. But prior to moving to Missouri, Robin was the Health Services Coordinator in the Alexandria City Public Schools in Virginia, where she was responsible for developing, implementing, and evaluating school health programs. Her broad experience includes a fellowship at the CDC in Atlanta, where she participated in the review and management of chronic health conditions in schools. Robin's experience and practice certainly demonstrates the principles of NASN's new 21st century framework: leadership, coordination of care, quality improvement, and public health. Robin says she is passionate about school health, school-based health care services, and supporting school nurses in their roles and as frontline public health practitioners. Robin?
Good morning. I'm so pleased to have this opportunity to share a story about the impact that school nurses can make in addressing chronic health needs in students and communities. Next slide, please. I often reflect on one particular story where the interventions and actions of just one school nurse created an awareness which in turn dramatically impacted many students in our community. As the health services coordinator in a busy urban school district, I had the privilege to hear from school nurses on a regular basis about the challenges and successes that mark their school nursing practice. So one day, an elementary school nurse told me about a student who she had recently encountered. This kindergarten student named Jose was being referred for a multidisciplinary evaluation due to his inability to sit still and attend in class. So as part of the nurse's screening evaluation of the student, she decided to look in his mouth. What she discovered was a mouth full of black, gaping holes where teeth should have been. And after an amazing amount of care coordination, including many, many calls and effort, this school nurse found an oral surgeon who agreed to treat the uninsured low-income child free of charge. After several visits for extensive remediation, the student's oral health needs were all addressed. And lo and behold, the academic concerns which originally led to his referral vanished. So I began to wonder about the magnitude of unmet oral health problems in our district. So in 2001, shortly after hearing this story, I learned of a small grant opportunity funded by Kaiser Permanente that would train nurses in performing oral health assessments. And I jumped at the chance to get trained and subsequently coordinated an oral health screening program at 3 of our elementary schools. A health history and written consent were obtained from parents prior to participation in the program. And I partnered with the school nurses in each school to provide the paper and pen risk assessment, a visual oral screening, anticipatory guidance, application of fluoride varnish, and referral and follow-up for diagnostic and treatment services as necessary. The school nurses at each school used their own school nurse care coordination to facilitate the follow-up of students identified in need of urgent oral health care. Next slide, please. So the outcome of this project was to identify a tremendous need in our student population. In the first year of the school-based oral health screening program in 2011 and 12, 600 students in grades pre-K through 8 participated. Of these, 173 were identified in need of urgent oral health care, including 5 students with 1 or more dental abscesses and many students with multiple dental caries. In fact, students were more likely to have 5 cavities than 1. The ability to identify that nearly 29% of our students screened needed further evaluation was a very important outcome of this initial screening project. Next slide. As a result of these oral health screenings, the school nurses began a collaboration with a vendor who provided dental health services in the school setting, thus eliminating a lot of the barriers to care. During the first year of the collaboration with this mobile oral health service, 213 students received oral health services in school. The service provided preventative and restorative dental services to students. And over the next few years, the program was extended to most of the elementary schools in the district. And while this outreach was successful, the services available to uninsured students were minimal. To address the unmet needs of a large population of uninsured students who needed care, one of the school nurses approached her own dentist with the need, and he agreed to treat 33 students free of charge. School nurses indeed raised the awareness of the importance of oral health in our student population and worked diligently to partner with community resources to help meet these needs. Next slide. So as a result of the screening project and the identification of the magnitude of the need, our school district has a heightened awareness of the oral health needs, and in 2013 decided to pursue an opportunity to apply for a HRSA grant to build a mobile health unit to serve some of the school district's neediest elementary schools. Working in collaboration with the local federally qualified health center, the district created a mobile clinic called the WOW Bus, or Wellness on Wheels, which began service in March of 2014. Here on the screen is a picture of the mobile clinic, which now serves several elementary schools with school-based oral health services for students who lack a dental home. One of the most significant outcomes of this project, besides addressing unmet oral health needs, is linking students and families with the community safety net provider, thus bringing a medical and dental home. So in closing, I am so grateful for Jose and for his school nurse and for all the school nurses who continue to work so hard to identify and address student health needs, and also for the opportunity to leverage community partnerships to make such a significant difference in the lives of hundreds of Alexandria children over the past 5 years. Thank you very much.
Thank you, Robin. That truly is a success story and shows what school nurses can do in the community. I appreciate you sharing the story. Our next panelist is Brandy Bolin. Brandy is the school nurse at Epps Island Elementary in Houston, Texas, and has been a school nurse for 6 years. Almost immediately, she recognized a need in her community and has set about to address those needs. She said she realized that if she was going to make a difference in the health of children, she also needed to work with the family. Brandy actively demonstrates a key principle from the NASN framework, public and community health, along with leadership. But when you listen to her story, all of her actions are student-centered, and I'm just excited for you all to hear her story. Brandy?
Thank you, Beth. Good morning, everyone. I'm Brandy Bolin, and as she said, I'm the school nurse at Epps Island Elementary in Houston, Texas. Currently, we have 720 students in kindergarten through 5th grade. Approximately 90% of my students are economically disadvantaged, and about 80% of our students are of Hispanic origin. So, you know, as nurses, we identify problems in our community every day. I saw a huge number of overweight and obese students and so many with acanthosis nigricans positive results. And so for me, this was such a big problem. And it was only my first year. And as a first-year school nurse, I thought, I can't do anything about this. And my biggest concern was that I don't have any time. How do we handle our day-to-day job, let alone tackle something like this? What on earth can I do? I'm just a school nurse after all. And so this is what I did. I started a little program in 2011, and this was my second year as a school nurse. And so to be clear, I did not set out to change the community because that's too big for me. I decided to step out of my comfort zone. I took an NASN Scope Childhood Obesity Prevention training and decided that why not? Let me write a grant. My kids need this. And so I came up with an idea, I wrote it down on paper, and I won. And so realizing that it takes an entire community to influence the health and education of a child, I decided to initially target pre-K students and their parents. We had 6 classes in the afternoon after school where the kids were taught My Plate concepts, and the parents were in a separate area learning about 6 different topics, which included things like counting calories, reading nutrition labels, making healthy substitutions, and then workout activities which can be done at home, and that's just a few. So then we encouraged the staff to start walking in a group after school on our track outside. The parents ended up watching us, and without even being invited, began to follow us. And before you know it, we had a group of 19 parents following us on the track every day, walking. And so while they walked, their children played on the playground, and as you can imagine, this made a huge impact. And it's such a small thing. Then we had our first Health and Fitness Community Day, where I invited the school staff, all of the families in the neighborhood, and many community partners. You can see that in 2012, my little program continued to grow because, well, why not? This time I also found many free resources and included them. And so each year the program got bigger, more parents would come, more staff would participate, and more community partnerships would form. And this is very important. I developed lasting relationships with community partners who continue to support our school and my students to this very day. I have health resources who have actually reached out to me to ask if they can come to our events. Next slide, please. And so, in 2014, you can see that it just carried on. And so, basically, we started some amazing projects. And we created the Epps Island Health Shorts videos. We made a video series which were 3 minutes or less, and we used real Epps Island students to discuss health concerns, including hand washing, covering your cough, calories in soda, and drinking more water. These short videos were shared during PE time. We also created, or I guess took place or participated in, the Girls on the Run program. This is an international program for girls in grades 3 through 5. We had 45 girls, 8 staff coaches, and Girls on the Run basically showcased all their achievements on bulletin boards in the hallway so other students could see what those girls were doing. Then kids began coming to school to show me shirts from races that they were running with their parents outside of school. In addition, we created a program with the YMCA, which I call Yeehaw, and I'll talk more about that in a minute. In 2015-16 school year, some amazing things happened. I decided to expand our scope just a little bit. I wrote a grant for $25,000 for a classroom set of pedal desks. And for those of you who aren't familiar, you can see in the picture they're desks, except they have pedals like bicycle pedals. And then we got books, and we called it a kinesthetic reading lab. I became fascinated by the subject and joined the Kinesthetic Classroom Collaborative in the Houston metro area. Many school districts who practice action-based learning come together and share ideas at this collaborative. I'm the only nurse in the collaborative currently, and the first nurse in the collaborative. I'll be taking 4 other staff members from our school to a training this summer to become certified to teach action-based learning theories and activities. And so, more about Yeehaw. And that's the next slide. So Project Yeehaw is a very special program along this journey. Being a member at the YMCA and being in awe of all of their activities for children, I decided that it can't hurt to ask if they could partner with me and my school. I had an idea in mind. I wanted a classroom segment and an activities segment, and we needed to meet twice weekly for 8 weeks. I wanted free YMCA membership for the duration of the program. I wanted a dedicated teacher and a curriculum that I could take home at the end and use forever, and I wanted this curriculum to include information for the entire family. You cannot reach the child without the entire family. And so I met with the YMCA program coordinator and shared my ideas, and then my timeline and the curriculum ideas, and that was that. We gave 3 month-long a 3-month-long membership to 10 families, regardless of the size of the family, and some families had 7 or 8 members. We invited these families as the educational portion was geared towards adults and children in grades 3 through 5. So the children that we targeted were in grades 3 through 5 and their families. We met twice weekly at the YMCA. The program was a huge success, if I do say so. And you can see me in the pictures. If you're there to support your program, it has so much more of a chance for success. And so by word of mouth and learning that the YMCA offers income-based membership costs, many families in our school community have now joined and utilize our YMCA. And next slide, please. And so the takeaway here is that as a school nurse, you have access to the entire school community. You are armed with the information that is required to create an arsenal for students to foster success in so many ways. You see the entire child where other parts of the school community only see their specific target area. You can be the link that connects all these parts to help create a healthy environment for your school community. And you're not alone. Who on your campus is a member of your team? Who can you start with? The PE staff, administration, perhaps an ambitious classroom teacher, science teacher, counselor? Do you have a parent liaison? Take a look around you. Start small, but get started. Foster relationships. For my school community, the partnership with the YMCA, the Oliver Foundation, Girls on the Run of Greater Houston, and the Kinesthetic Classroom Collaborative will be invaluable lifelong partnerships. Our local business partnerships with nursing colleges, grocery stores, dentist office, and vision centers, just to name a few, are so important. So think right now, who are your partners? And then, of course, why does it all matter? Next slide, please. So in 2011, out of 100 pre-K students, 29 were obese. By the time they were in first grade, only 23 remained obese. And to think, I started out as just a nurse who was going to try something small. Look what happened. So in the end, I know that we're all very busy, and I know you have a dozen reasons why you can't do it. But for every reason you give for why you can't, I can give you 5 reasons why you can, and I can help you. Next slide, please. And so thank you all very much for listening. I hope it was helpful, and if you have any questions at all, please be glad. I'll be happy to answer any emails and get back with you right away.
Thank you, Brandy. That's quite a story and really inspiring to hear the difference that you've made in the lives of your children and their families. So thank you for sharing.
Thank you.
Our next panelist is Bobby Shanks. Bobby is the school nurse coordinator at Elko County School District in Elko, Nevada. Elko County has a population of 53,000 in a county that covers more than 17,000 square miles. To put that vastness of area in perspective, that computes to 205 acres per person. She has been a school nurse for 18 years and is a Johnson & Johnson School Health Leadership Fellow. She is also a member of the board of the National Association of School Nurses. Our NASN framework lists the components of leadership as a change agent, an advocate for children, and one who develops policy. I think that describes Bobby. Bobby, will you share what you all have been doing?
Thank you, Beth. It's a pleasure to share our story. This presentation is titled Barriers to Immunization in Frontier, Nevada. As you stated, Elko County is unique in that it's a large county geographically, spread out over 17,000 square miles. We have a population of about 50,000 people. The nearest city with any major healthcare services is at least a 3-hour drive. So Elko is considered a frontier community due in part to this distance to a major healthcare facility. Our student population is about 10,000 students. Next slide. Approximately 10 years ago, Elko County lost our public health nurses. And currently, Elko is the only county in Nevada without a public health presence. Without public health, students had a very difficult time getting their immunizations. As a result, Elko County School District became an immunization provider. Each year our program has grown, and for the past couple of years we have given 4,000 plus immunizations each year. Next slide. The breaking point for us is during the 2014-15 back to school clinic, we had a much larger turnout than any of us could have anticipated. Our central office building was filled and lines surrounded our building. It was a pretty crazy day, couple days. Wait times for students to get their immunizations were upwards of 4 hours. After this clinic, we realized that our school district could not sustain this level of service. Next slide. I saw an opportunity with the Johnson & Johnson School Nurse Fellowship Program, and I put together a team, and we were accepted into that fellowship program and began work on an enduring change plan. Through a windshield survey and a review of the Elko County Community Needs Assessment, we identified the following barriers to immunizations in our community. One being no public health, two, very high fees for students to get immunizations, rare same-day appointments were available, there are limited Medicaid providers, and long wait times for appointments. So what this means, assume if you just move to Elko and you have 3 children, all of which need, let's say they all need a hepatitis A, this could cost approximately $300 for each child, and you're likely to have a three-week wait time for that new patient visit. So that's a cost of almost $1,000 just for one shot each for that family. This impacts the student's education as they're not in school. It impacts the family as parents are likely missing work, and it impacts the parent's employer as they are missing work during this time. So it's a snowball effect that impacts everybody. Next slide. So the aim of our Enduring Change project is to remove these barriers to student enrollment, to raise awareness of community health needs, and facilitate enduring change. We are actively working with stakeholders from the community and from the state. One of our goals is to reinstate a public health presence in Elko County. Next slide. So our outcomes to date, first, one thing we were proud of, we were able to work with a state epidemiologist to get a health report for our county. This report highlights the disease impact on our community. The report specifically addressed vaccine preventable diseases and identified high rates of vaccine preventable diseases in Elko. As such, we became aware that immunizations needed to be addressed in our community with adults and young children in addition to our school-age children. Secondly, for the 2015-2016 school year, this school year, we worked with stakeholders to share the burden related to the number of students who needed immunizations to start school. This was very successful. Again, the collaborative gave about approximately 400 vaccines, and by spreading that burden, it greatly decreased the burden to Elko County School District. However, we consider this a stopgap measure, and the access to immunization really needs to be addressed at the community level. And finally, we facilitated the development of a county board of health, and this board met for the first time this January. We presented at the first county board of health meeting, and it was a great way to share the data we've collected. Establishing public health in Elko County will serve to knock out one of the barriers to immunizations in Frontier, Nevada, in addition to addressing other community health needs. We really felt that this was a step in the right direction, working towards a public health presence in our county. Next slide. So our next steps include continuing to work with healthcare providers to increase access to immunizations and to continue progress towards getting a public health entity here in Elko County. We've attended several town hall meetings regarding chronic disease and prevention planning and fund distribution, and we will continue to be at that table. We have met with Nevada legislators on Capitol Hill. It was interesting. Many were very surprised to learn that Elko County does not have any public health, so we're working hard to raise that awareness. And we are working, continuing our work towards removing the barriers to immunizations. We realize that change is slow, but our enduring change plan is moving in the right direction. Next slide. So I did want to thank you for the opportunity to share our work and present my leadership team. We couldn't do this work as a single person, as you know, so that teamwork and with our team and our stakeholders is very valuable. And there's a copy of our award-winning poster. Thank you.
Thank you, Bobby. And that's just wonderful that how you recognize that need in your community. You truly are a change agent and changing policy, being instrumental in getting the Board of Health, developing a Board of Health in your community. Truly incredible, based on the needs of your community. I hope you all have enjoyed these stories just as much as I have, and I thank Robin and Brandy and Bobby for sharing your programs. As always, I am impressed by school nurses and the work that you do to keep students healthy, safe, and ready to learn, and your communities as well. You see the bigger picture. Thank you. Dr. Hassmiller, thank you for joining us to share the vision for healthy communities with nurses leading the way. We certainly share your vision, and we're in the community ready to do the work and doing the work. So thank you for joining us. And
Thank you, Beth. And
go ahead. Go ahead.
Yes, I'd just like to add that those stories were absolutely amazing. As a former public health nurse, I did have the opportunity to work with a lot of school nurses. And I would love to, because we've heard these three stories, I would love to connect the speakers that we just heard from to their action coalitions. It is my job now with this national campaign to take action coalitions who have been working on the recommendations to really broadening the picture to building a culture of health. And I would love the help of school nurses. Beth and Donna, if there are any school nurses in the audience who would like to be connected to their state action coalitions, I would love to make that email introduction individually, even one by one, so that I can introduce the school nurse to the state action coalition. So maybe they can contact you. I'm happy to give my own email address, and maybe I'll do that now for anybody who'd like to contact me. It is HASS, like Sam, MI, at rwjf, like Frank.org. So again, it's HASSMI at rwjf.org. I am amazed by school nurses, the work they do. I know that there are many more stories out there, not just these three. And again, thank you so much to your association for the work that you do. Amazing.
Thank you.
Thank you, Sue. So this is Donna, and the challenge is out there for any of the school nurses listening on this webinar to reach out to Sue Hassmiller, to reach out to Beth Maddie, to make sure that your story is told and that you're connected to the State Action Coalition. Right now, we'll turn this over to Margaret Salucci, NASN Director of Communications.
Thank you, Donna, and thank you all so much for participating in this very informative discussion about school nurses building a culture of health. All attendees will receive an email with a link to the slide deck and recording. And finally, as you can see from this slide, NASN's annual conference will be here before you know it. NASN 2016, Learning, Linking, Leading. Start planning to attend NASN 2016 in Indianapolis, Indiana by setting aside some time to attend. Visit nasn.org/NASN 2016 to access the Attendance Justification Toolkit. and so much more. This is Margaret Salucci, NASA's Director of Communications, and on behalf of NASN, thank you for joining us today.